lot of patients ask, why do I not do a lift with explant surgery? There are many reasons why. Number one, the patient may not need. She may be young and she will recoil, especially with the bra compression and then the binder. She will recoil on her own, and a lift is not always required. Number one. Number two, the way I place my sutures, especially at the lower part, where it actually kind of gives a pseudo lift, if you will, and overall with time as the skin and the breast tissue retracts, gives the impression that the body in itself will allow for that breast tissue to recoil and the lift is not required. Majority of the times the implant is placed below the muscle. That in itself is a 4-hour process at least in order for me to definitively remove the implant plus capsule off of the rib. I don't want to prolong the patient's time on the OR table and lead to complications like clot, infection, among others, including seroma, for a surgery that may potentially lead to nipple and skin necrosis, or a lift that may further lift the nipple areola up and may look very disfiguring. Also, the risks of inflamed, angry tissue that you may not want to necessarily manipulate, such that the lift may potentially hurt the tissue and the sensation might be lost, again, for a surgery that may not be required. This is a surgery that can be done if desired later, and as you will see, majority of my patients, well over 80% of them, are very surprised, happily surprised, that they were not candidates for a lift. So these are my criteria and my determinations as to where certainly there are some patients who absolutely do need one, but not at the time of the explant. Again, this is all for the safety and betterment of the patient, and with the surgery that, as you will see, most of the patients do not require a lift at the time of explant. This is Dr. Khan, Executive Plastic Surgery.